Here we have very interesting MRI of the left shoulder in a 35-year-old male with history of shoulder pain. The history provided is history of shoulder injury while training and felt loud crack, felt as if shoulder is coming out. So we have got standard shoulder MRI sequences. What obviously catches our eye is this abnormal signal in the posterior aspect of the deltoid muscle. So there is definitely a moderate size area of complete tear of the fibers in that region. But given the bulk of the deltoid muscle, so this will be classified as a partial intrasubstance tear, most likely managed conservatively. There is also surrounding muscle edema. The important thing to remember in reporting in radiology is once you document the abnormality which is visible to anyone's eyes, you need to make sure you're not ignoring the other findings. So, the second abnormality which catches our eye is here in the anterior aspect of the humeral head. So, what is this abnormality? How do you describe it and how to infer? There is ill-defined abnormal bone marrow signal in the enteromedial aspect of the humeral head, and if we look carefully on the axial T1, the abnormal bone marrow signal is more in the subcortical region, and as we come to the inside of the humeral head, it reduces. And also, we have got this shattered appearance within the bone as if the glass is shattered but not completely broken. Very typical pattern of microfracture. And if you look carefully, there is alteration of the morphology of the enteromedial aspect of the humeral head at the site of the bone contusion. So, what is this? So, this one, if I reverse it, it looks exactly like a Hill Sachs lesion, but this is anterior, not posterior. So, hence, this is reverse Hill Sachs lesion, which is acute or subacute. Whenever we see reverse Hill Sachs, it means the patient is likely to have had posterior subluxation or dislocation of the shoulder, not anterior. Hence, we need to look carefully at the posterior labrum now. So, if we look carefully in the posterior labrum, there is a tiny dip both anteriorly and posteriorly, but the labrum is held in place, and as we come inferiorly, the labrum is held normally, and superiorly, the abnormality is extending up to the posterior labrum but stops there. So this feature is most likely to represent an undisplaced posterior labral tear with reversal sacs. So in summary, here we have got a very good demonstration of reversal sacs lesion and posterior labral tear along with a moderate sized partial intrasubstance tear of the deltoid muscle.